Hi, I am Dr. Julie Gaither. I am an epidemiologist and postdoctoral fellow with the Yale School of Medicine and the Department of Veterans Affairs. So in light of the prescription opioid epidemic that has affected the U.S. adult population in recent years, our objective with this study was to examine how hospitalization rates for opioid poisonings in the pediatric population have changed over time. In addition, because prescription opioid abuse is thought to be a precursor to illicit opioid use, we also examined in older teens heroin overdoses and then looked at overdoses for methadone. Methadone is a prescription opioid that's used to treat opioid addiction as well as chronic pain, but it is frequently diverted for non-medical use. For this study, we looked at the incidence of hospitalizations in children and adolescents 1 to 19 years of age. And then we looked at heroin overdoses in children and adolescents 15 to 19 years of age. And then we also looked at intent across all age groups. So whether the poisoning could be attributed to an accidental poisoning or whether it was suicidal in nature. The key findings for this study, one, were that between 1997 and 2012, we identified approximately 13,000 hospitalizations for prescription opioid poisonings in children and adolescents 1 to 19 years of age. The highest incidence for each year of the study occurred among the oldest children, the 15 to 19-year-olds, but we were surprised to find that the greatest increase over time actually occurred among the youngest children, those 1 to 4 years of age. Concerning heroin overdoses, we found that rates increased by approximately 150% from 1997 to 2010. And then very importantly, for methadone poisonings, they increased by 950% during this time frame. So in less than 2 decades, the increase was nearly tenfold. The primary limitation of this study was that we used ICD-9 codes to identify poisonings in children, and these billing codes are susceptible to miscoding errors and omission errors. The second limitation was that we did not have the data to really be able to present a full clinical picture of the circumstances behind the poisoning. And then third, we did not have the data to determine whether the trends that we saw extended beyond 2012. The conclusions for this study were that our findings mirror those that we've seen in adults, and it really illustrates that this is a systemic problem that affects individuals across the lifespan. We found that poisonings for opioid hospitalizations increased twofold over from 1997 to 2012, and that the children most vulnerable to opioid poisonings were the youngest children and older adolescents. So the next steps for this study are really to be able to fully address the prescription opioid crisis. Greater attention needs to be paid to the pediatric community, who make up 1/4 of the U.S. population, and mitigating the effects of prescription opioid exposure will require comprehensive strategies that really address opioid packaging, storage, and misuse. And specifically, we believe that public health interventions such as prescriber and patient educational programs are needed, policy initiatives are needed, as well as consumer product regulations that will result in better packaging and storage.